Hello everyone, my name is Pooja and I've done my master's in medical microbiology. And from the past 1.5 years, I've been associated with MyAussieTutor and providing online academic services. So today we'll be discussing a very interesting topic, which is smoking issues in Maori community. So what are the learning outcomes of this presentation? Firstly, we'll get a brief understanding about Maori community and what are their needs and cultural preferences. Secondly, what are the socio-economic status and how the social determinants of health is impacting their overall health and well-being, and how these are triggering the more prevalence of smoking among the community in terms of education and unemployment. Thirdly, what is smoking cessation initiative and how the nursing professionals will play a role in the positive effectiveness of the smoking cessation, and what are the role of government in ensuring and designing safe policies for reducing the prevalence of smoking among the Maori community. So to begin with the introduction, we'll discuss what is this Maori community and how social determinants of health is impacting their overall life. So Maori are the indigenous people of New Zealand's mainland. Maori has been compartmentalized as a marginalized group and have received and are being receiving unequal access to healthcare resources due to the presence of existing social determinants of health. The New Zealand health reports conclude that Maori community has a greater smoking prevalence with compared to non-Maori community. There are various social determinants of health which are triggering the more prevalence of smoking among the Maori community, especially among the children and the adolescents belong to this target community. So there are various factors including education and access to quality education, which will decrease the health literacy among the children. And secondly, the economic stability. They are not economic stable because they do not have equal access to education. That's why most of the people remain unemployed, and this will decrease the economic stability among the Maori community. Thirdly, the social and community context. They have their cultural beliefs and values which. And fourthly, what is the neighborhood and built environment, because they are being born in an environment where all the children and adults are being treated unequally and they do not receive equal access to education and various other healthcare resources, and it is a reason that they are more prone to addiction like smoking. Lastly, the healthcare resources are not even are more costly, and their poor economic stability will not support them to receive equal healthcare services, and this is also a reason that they are lacking the effective healthcare resources and the education policies, which is more increasing the risk of children and adults towards smoking. So these all are the effects and negative effects, to be more precise, of social determinants of health, that is increasing the risk of Maori community towards smoking. And what is the health statistics? We'll discuss in this slide. It is known that approximately 28.7% smoking prevalence is present in the year 2019, which includes 145,000 smokers in total. And the daily smoking prevalence is 31.4, which is about 158,000 tobacco users among the Maori community. So this percentage is very significant, and need and care need to be provided to this population so that this percentage will be reduced to lower limits and their overall health and well-being can be improved. Moreover, the Maori adults smoke 28.7% of the time regularly. Moreover, Maori was 3 times more likely to smoke than the non-Maori community each day. And smoking tobacco can cause serious health impacts, which include cancer, cardiovascular diseases, and respiratory diseases. In the cardiovascular or the serious pulmonary diseases, COPD, also known as chronic obstructive pulmonary disorder, is a more common and serious disorder that has been triggered by increased smoking among the Maori community. This indigenous Maori accounts for a 24.4% death rate owing to smoking as compared to rest of the population in New Zealand. So these all health statistics is signifying a need to design effective interventions for reducing the prevalence of smoking among the Maori community in order to improve their health by lowering the risk of various chronic and pulmonary health disorders. Moving to the next slide, we'll discuss the health outcomes of this population. As we know that smoking is widely recognized as an important risk factor for non-communicable diseases. Lung cancers contributed to 30.7% of all smoking-related mortality, followed by chronic obstructive lung disorder or COPD, it is commonly known, 26.0%, and ischemic heart disease around 13.2%. This COPD is a common chronic disease that causes substantial morbidity and mortality, especially in Maori, and places a significant health burden on the New Zealand healthcare system as well, because they have to design effective healthcare strategies for improving and lowering the risk of COPD among the Maori people. This increased burden of these chronic illnesses is impairing health outcomes and eventually reduces the overall quality of life. Therefore, it is also triggering a common objective of designing effective intervention for all policies by the government so that the risk and prevalence of smoking can be dissolved among the Maori community, which will improve their overall health and well-being. So, what is the role of social determinants of health in triggering this smoking prevalence? Firstly, poverty. Poverty can lead to unequal education and unequal employment. The higher education levels have been linked to increased economic growth, which can lead to a higher standard of living. In terms of unequal employment, the Maori youth have a 25.7% rate of unemployment as compared to non-Maori community, which is around 14.2%. So these all data is reflecting that the social determinants of health, or to be more precise, the poverty or poor financial stability of the community is leading towards unequal education and unequal employment, which is totally reflecting a more risk for smoking abuse among the children and the adults as well. So, smoking cessation is a health initiative which has been designed to reduce the prevalence of smoking among the Maori community. Smoking cessation is a health initiative. It will focus on promoting lifestyle changes along with behavior modifications for good health. It will clear the common doubts of people related to smoking and empower them to self-manage. It will reflect the positive as well as negative benefits of smoking and thereby increase the education or health literacy of the user so that they will be able to take healthy healthcare decisions for their health and well-being. It will also ensure positive effects of good food and exercise as part of smoking cessation. Safe use of nicotine patch, gum or chewable to help you stop smoking. So, the good food and exercise is a very essential part where good food will provide a healthy diet and exercise will including rehabilitation exercises or deep breathing exercises will remove or lower the risk of pulmonary health disorders like COPD, followed by good food which will improve the overall immunity of the users, of the smokers. So good food and exercise can modify the overall lifestyle of the people who are smoke abusers so that their overall health can be improved. It will also provide alternative ways like use of gum, nicotine patch, or chewables in order to reduce the prevalence or use of smoking among the Maori community. So, how this is a culturally safe initiative, wherein the healthcare professionals need to reflect cultural competence while using this initiative, that is smoking cessation. The nurse or the healthcare professionals have to reflect a culturally safe behavior, which can be shown with the help of a safe or communication by including both verbal and non-verbal communication. Communication is a way to establish a strong therapeutic relationship with the Aboriginal people and reflect cultural competence. The nurse can also engage verbal as well as non-verbal forms of communication to make strong and collaborative relationships. A nurse can coordinate with the other healthcare professionals and can engage them in making suitable care plans, like for food, a nutritionist or a dietitian, and for exercise, a physiotherapist can be engaged. It is a cultural specific health care program for the common good of the people, which is reducing the prevalence of smoking among the Maori community. So what all are the positive aspects of the health initiative, which is smoking cessation? The absolute difference in daily smoking prevalence between Maori and New Zealand dropped to only 3.9%. Smoking impacted the population inappropriately and was measured as life expectancy in years and was reported as 73.5 Maori men and about 77.3 years in Maori women. So this is a huge ratio which has been improved in terms of life expectancy after the use of, or we can say healthy use of, smoking cessation initiative. The New Zealand government is also taking initiative for smoking cessation, and initiative like educational programs for reducing the prevalence of smoking among the Maori community, wherein better health and health promotional education will be provided so that the people will be able to understand the negative and positive aspects of smoking and can take better health decisions for improving their overall health and well-being. So to summarize, we can say that the Maori population is more prone to smoking, which can trigger various chronic illnesses. The social determinants of health is favoring poor education and financial instability. Therefore, the nurses or the healthcare professionals will have to engage their critical thinking and effective communication skills to engage the target population in smoking cessation. Nurse can coordinate with the stakeholders, including the other healthcare professional like doctors, physicians, physiotherapists, or a psychotherapist, for as well as the government for more funding and education to the people to promote better health. So we can say that this presentation will increase the knowledge of the people about the Maori community and how social determinants of health is impacting the more prevalence or impacting the overall health of the Maori people, thereby focusing their mind towards smoking. It will also help to gain a better understanding about the role of government and smoking cessation initiatives for improving the overall health by minimizing the risk of smoking among the Maori community. So these are all of the references that we use. Thank you and have a nice day.